Aloha guys, Dr. Todd Walker's coming back at you. Yes, we're getting serious now. We're going to talk about parental and non-parental medications. Unit 11. Start with non-parental, which means, of course, pills. Most common method is administration of oral medications. Advantages: economical, safest, most convenient. Disadvantages: sometimes they taste bad or smell bad. Certain drugs can discolor your teeth, gums, tongue. A lot of meds can irritate your stomach. They can be altered by digestive enzymes, which is why, for example, insulin cannot be taken orally. Poor absorption, less predictable. Difficult to take because if the patient is suffering from a lot of nausea and vomit. Or maybe you just flatly refused by the patient. I ain't taking no pill, that kind of thing. All right, so for non-parenteral, equipment, supplies, medication order, record system, medication cart, cabinet, tray, cup, dropper, water cup, drinking straw, syringes, tablet crusher. Some of them may have to be refrigerated. Sink, soap, paper towels, pen. Yes, covered about everything there. Preparation, delivery of oral medications. They can be a multiple dose solid, multiple dose liquid, or unit dose solid or liquid. Preparing and administering a crushed medicine. Ensure medication may be safely crushed, because some of them you can't, guys. Most compressed tablets can be crushed. Time released, buccal meaning in the cheek, sublingual meaning under the tongue, enteric coated, the kind that hopefully won't irritate your stomach, cannot be crushed. But just the ordinary ones. Why would you have to crush them, guys? Because you got somebody, a child or an adult that has difficulty or cannot take a pill. You can crush it and maybe mix it in with something. A tablet crusher or a mortar and pestle work best. May sometimes mix medication with food. Ensure all medication is taken. Okay, now sometimes for different reasons they add medication to the eye. Administration of ophthalmic medications. Installation, slowly pouring or dropping a liquid into a cavity or onto a surface is installation. That's an important word to know, guys, because they use that some. For example, eye drops are an example of installation. Application, to bring something in contact with something else, like to rub an ointment on the skin. So be sure you know the difference between installation and application. Okay, we're still talking about ophthalmic medication. Perform eye installation, wash hands and put on gloves, assemble supplies, prepare patient, have patient look up to the ceiling, place drops in the center of the lower conjunctival sac. What's that? Leading the eyelid, inside of the eyelid. Do not touch the eye with a dropper. Why? You've contaminated the dropper, man. How are you going to use that on other patients? You want to throw out that expensive med because you, like a goo, if you touch the eye with it? Okay, continued. Performing eye installation, continued. Have patient close the eye and roll the eyeball to distribute the medication. Blot excess from the eyelids with a cotton ball. Dispose of supplies, wash hands, document procedure. Guys, you have to be careful because infections can be easily transmitted through the eye. Okay, now, administration of otic medication goes in the ear. Otic means ear. Usually administered by installation. Well, you fill that ear canal up and uses treat infection, reduce inflammation, soften earwax or cerumen, localize anesthetic effect, immobilize trapped insects. Yeah. Continued. Contraindications: if they have a perforated eardrum, if they're hypersensitive for some reason, for herpes or other viral infections, or systemic fungal infections. I'm not sure why that is, guys, but I know fungal infections can be very, very stubborn and difficult to get rid of. Okay, how to perform an ear installation. Wash hands, put on gloves. Assemble supplies, prepare patient. Adult, pull top of the ear upward and back. Child, pull down and back. Why? You have to straighten out the ear canal, guys. If you take an otoscope and you look in the ear, you can only see a little ways and then it goes around a curve. On an adult, by pulling the ear up and out, it straightens the canal out and you can see all the way to the eardrum. But in small children, I believe it's 2 and below, you have to pull down. The canal changes its route as you age. That's the reason. And then instill medication. Performing ear installation. So you have patient remain in position for approximately 5 minutes. If instructed by physician, insert moistened cotton ball for 15 minutes. Why? To keep the stuff from running out. Dispose of supplies, wash hands, document procedure. You also, guys, didn't use a little kidney basin typically and put it up here too. They didn't, and they should have mentioned that. Administration of nasal medication. Installation, spray and inhaler uses, relief of nasal congestion, rhinitis, which of course is runny nose. Contraindicated if hypersensitive. Long-term use of nasal decongestants may cause rebound effect. I mean, what? You get even more congestion in there. So you don't want to use any of that stuff unless you have to, guys. Best administered by the patient. Instruct patient to clear nasal passages prior to use. Why blow your nose or hold one and go haw? Something. Administration of rectal medications, suppositories. Usually when you say suppositories, guys, you think of the rectum, but it also can be, there are vaginal suppositories and urethral suppositories as well. Why there? Well, it might need the medication be delivered directly there. Or in the case of somebody that has projectile vomiting, you can give them the anti-nausea drug phenergan, which works real well, but not if they vomit it up before it can be absorbed, so you can give it as a suppository. Ointments. Drugs combined with petroleum jelly, Vaseline, or lanolin. Enemas. Delivers a solution into the rectum or colon. Uses laxatives or bowel preps. Rarely to administer medication, but in the old days it used to be used for that. Special delivery medication, patches consisting of 4 layers. Transdermal medication, guys, like nicotine patches. Medical assistant must always wear gloves when applying transdermal medication. Why? Because it might get into you. You may not want it. Remember, remove previous patch before placing a new one in the patient's skin. And I can't see that you wouldn't realize that. Also, too, guys, you got to put it in a different area, too. Administering drugs by inhalation. Upper respiratory problems, #1 reason people seek health care. Local treatment for respiratory tract infections. Systemic treatment for serious respiratory infections. Supply medication can be absorbed in the bloodstream through the lungs. Inhalation methods. You can have a handheld inhaler, a metered dose inhaler, dry powder inhaler. A nebulizer, I mentioned it before, is a little device, guys, that you put in your home, like someone with COPD, for example. And the theo or other medication is dispensed through the nebulizer as a mist in the air, and the patient breathes it in. Typically, you'd want to take it into like a bedroom or something, where it's a fairly smaller room, not like where it gets out through the whole house. Intermittent positive pressure breathing machines. If this is not a CPAP, guys, I don't know. Do you know? Oh, I guess you know what a CPAP is, right? People that have sleep apnea. Administration of oxygen, colorless, odorless, tasteless, essential for life. Yeah. When lack of oxygen threatens survival, supplemental oxygen should be prescribed by a physician, given immediately. Normal adult range, arterial blood is 80 to 100 millimeters of mercury. Oxygen saturation of blood, guys, should be in the 90s, and it's easy to measure that. You'll learn how to do it in the lab. They put a little thing on a little spring-loaded device in your finger, and it measures it. Dosage based on individual needs. Order is liters per minute. Now, this is when you're given supplemental oxygen, liters per minute, and percentage of oxygen concentration. Methods of delivery. Nasal cannulas. This is one you've seen people in the hospital. They've got the little tubes coming around, just a little device that goes into their... It's the simplest, most convenient, but it's only good for lower concentrations of oxygen. If you have to have more, then they have to put a mask on you. Types: disposable, partial rebreather, non-rebreather, Venturi. I don't know what that is, guys. Sorry. Higher concentration, more humidity. So it just depends. If you need a little oxygen, cannulas are quite common. A lot of people that are hospitalized will have these. But if they're having a more substantial problem, then they have to. And some of them are a mask that fits over the head that's like almost like a scuba type mask. Oxygen safety precautions. Now, naturally, oxygen is what causes things to burn, guys. It's highly reactive. So it goes without saying that you don't want to be smoking around it. But I swear, you'll see people doing it. Not in the hospital, because they'll boot your butt out for that, or they'll lay the law down. But avoid use of small electrical appliances. Why? They might spark and then kaboom. Electrical medical equipment should be used with extreme caution. Explain precautions to patients and family. That's who you got to worry about. Sitting there torching one up at home when you're sitting there. Are there people who would do that? Oh, you're so foolish to ask that question. Guys, you will never, ever fail to be fail to be blown away by people. Administering drugs by local application. It means like rubbing on ointments, lotions, liniments, wet dressings, poultices, and plasters. Moving along. Administration of parental meds. What are parental meds? Give an injection. There are 3 kinds. And this only has 2 of them. There's intravenous IV, which goes directly into a vein, which is something, but usually medical assistants do not do that. You have to have someone a little higher up. Intramusculars, where you just put it straight into the muscle. IV has the fastest effects, intramuscular next fastest, and then you can go subcutaneous up under the skin. It has a slower effect, and there's also an intradermal. I haven't mentioned that here. Advantages of injectable drugs. Effective delivery when oral route is difficult or impossible. They can't take a pill, they're unconscious, whatever. It's not altered by gastric acids and not lost from vomiting. Delivery of precise amount of medication to a targeted area. For example, if an athlete needs an injection of cortisone directly into an injured knee, that puts it right in there. Disadvantages. There's a risk of infection, guys, if you don't do it properly. Incorrect technique or equipment, poor technique. You don't wash your hands properly, if you don't sterilize things. Allergic reactions may occur more quickly or may be more severe than with oral meds. Can cause injury to tissue, nerves, blood vessels. Needle can strike a bone in a geriatric or pediatric patient. Why them? They don't have much meat. Can cause a hematoma. Hematoma is where it starts bleeding under the skin and you get a big tumor of blood. It's not permanent, but it doesn't make patients happy. Okay, preparing. Establish rapport. Hey, dude, we're going to give you a shot today. I'm kidding, of course. Be courteous and professional. Give patient a chance to ask questions. Provide privacy. Never tell a patient injection will not hurt. Why? Because then they're going to know that you're a liar. Educate about side effects. Now, I always say this, guys. Modern hypodermics syringes are very thin and they're very sharp and they're only used one time and they really don't hurt much. An IV hurts more, but just an injection, you barely feel the things. But you would be amazed by the number of people who are scared of needles, including big, burly, swarthy-looking dudes that have tattoos all over them. That's the thing, it's crazy. I've got 2 tattoos, and I'm not proud of them. Actually, one I am. This one I got in 1978. I was a paratrooper in the Army, and that airborne tattoo I got in 1980. And I don't know about now, but it hurt like hell when I got a tattoo. Infinitely more painful than getting an injection. But you'd be surprised the number of big old dudes who's got tattoos all over their butts and will pass out from a needle. So, like I said, it never fails to amaze. Patient assessment, age and size. Body size may determine the size of the needle or the amount of medication. They mention geriatric and pediatric patients because they don't have as much meat on their bones. And guys, you don't want to spear a bone with that thing. Physical and mental condition. Consider other conditions such as hemophilia, where they're free bleeders and hard to stop bleeding in pregnancy. Patient assessment. Injection site. Look for a site with good circulation that's free from lesions, scars, or inflammation. Gender. Men generally are more muscular than women and generally have tougher, thicker skin than women. Generally. I'm going to finish up here in a moment and continue on. Site selection. Subcutaneous is under the skin. You give a subcutaneous injection. Those of your medical assistant students, you're going to learn this and you're going to do it in the clinicals at a 45-degree angle. Just below the surface of the skin in the following locations. You can do it in the abdomen, the upper thigh, the upper arm, which is usually where it's done. Lower back, upper buttock. It's usually done in the upper arm. Intramuscular. It's given at a 90-degree angle. Okay, we're about to run out of time, guys, so we're going to stop here. We've got a few more, and we'll do that in the next video. Dr. Tom is signing off momentarily.